Welcome to the deep dive. Today we're really getting into the structure of things, focusing on joint and bone health.
That's right. We're looking at arthritis, osteopenia, and osteoporosis, these conditions that affect so many people.
And if you listening have been following the usual advice, maybe cutting down sugar, taking calcium, perhaps some collagen.
Which are all reasonable things
Yeah.
based on common knowledge.
Exactly, you're informed, but maybe missing a really critical part of the picture. So our mission today is to go deeper than that standard advice.
Definitely. Because the usual recommendations, well, they often zero in on the bones themselves or tell you to rest.
Right.
But what the research increasingly shows is, honestly, quite surprising. The real key might be in your muscles, your metabolism, and, believe it or not, your stomach.
Your stomach. Okay, that's intriguing. So we're going to challenge some ideas today.
So sure.
Like why resting that painful knee could actually be the worst move, and how something as common as an antacid might speed up bone breakdown.
Exactly. Let's unpack that.
Okay, first things first. Let's just clarify these terms. We hear arthrosis, osteopenia, osteoporosis. How do they differ? What's the progression?
Okay, good place to start. So arthrosis, or you might hear osteoarthritis, that's really about the joint surface.
No, cartilage.
Precisely. The cushion at the ends of your bones, especially in places like knees, hips, the spine. It's wear and tear, a kind of structural degradation.
And arthritis, that's different.
Yeah, arthritis just means inflammation in the joint.
Yeah.
Now, you can have both osteoarthritis often involves inflammation, but they aren't exactly the same thing. Arthrosis is the wear, arthritis is the inflammation.
Got it. So what about osteopenia and osteoporosis?
Okay, so now we're shifting focus from the joint surface to the bone itself, its internal structure.
And bone isn't static, is it? It's alive.
Absolutely.
Yeah.
It's constantly being remodeled. You have cells that break down old bone and cells that build new bone. Think of it like a continuous construction project.
Okay.
The issue is, around age 30, give or take, our ability to rebuild starts to lag a bit behind the breakdown.
So the balance shifts.
Right. And osteopenia is that initial stage. You're losing bone density. The capacity to regenerate isn't quite keeping up. We see this commonly after 50, especially in women post-menopause, because of hormonal changes.
And if that imbalance gets worse.
Then it can progress to osteoporosis. This is more advanced. Think of the internal scaffolding of the bone, these little bars called trabeculae. In osteoporosis, they become thin, weak. Some even break down. The whole architecture is compromised.
And that's when things get really serious, right? It's not just aches anymore.
No, absolutely not. The big danger is fragility fractures. A simple fall, maybe even just sitting down too hard, could lead to a broken hip or a crushed vertebra.
Wow.
Yeah, it can cause immense pain and often a permanent loss of independence. So understanding how to stop or even reverse that progression is, well, it's vital.
Okay, this leads perfectly into our first big myth-busting point. You
Yeah.
hear it all the time. My knee has terrible arthrosis, or I have osteoporosis. Doctor says avoid impact. Don't run. Maybe don't even walk much. Rest.
The rest prescription.
Why is that advice, which sounds so sensible, actually really problematic?
It sounds logical, right? Protect the damaged part. But here's the thing. We need to understand how joints, especially cartilage, get nutrition.
Oh, okay.
If you look at cartilage, it's white. That tells you something important. It doesn't have its own direct blood supply like muscles do. It's not irrigated.
Huh. So how does it get nutrients if blood vessels don't go right into it?
Through movement. It relies on a mechanical process called imbibition, basically a pumping action.
Pumping.
Yeah. When you walk, run, jump, lift weights, any movement that compresses and releases the joint, you're physically squeezing fluid, nutrient, blood, minerals into that cartilage and joint space. It's like a sponge.
I see. So the movement itself is what feeds the joint.
Exactly. So the moment you completely rest, you turn off that pump.
You starve the tissue.
You starve the tissue.
Yeah.
That's why repose, complete stillness, is absolutely contraindicated. It lets the arthrosis and osteoporosis get worse, faster. Activity, moving, lifting, muscle contraction signals the body to regenerate.
That really flips the script on conventional wisdom.
Okay, but then the obvious question. If I have severe arthrosis, moving hurts a lot.
Yeah.
Isn't that the bone grinding on bone?
That's the common assumption, but here's another fascinating insight. The arthrosis itself, the worn cartilage surface, it doesn't actually have pain receptors, nociceptors.
Really? The cartilage can't feel pain.
Correct. The pain you feel isn't the bone-on-bone contact directly. It's the intense inflammation around the joint that's causing the trouble.
Inflammation.
Yes. That inflammation irritates and compresses nearby nerves. The pain is essentially a warning signal from the inflammation, a protective reaction trying to make you immobilize the area.
So the goal isn't just to stop moving, it's to address the inflammation first, and then get moving again to feed the joint.
Precisely. Manage the inflammation, then restore the healthy movement.
Okay, let's shift gears to nutrition. Myth number 2, milk. Generations grew up hearing, drink your milk for strong bones. What does the research say about cow's milk for human bone health? Well, look, cow's milk is designed perfectly for a calf. To help it grow very quickly. It's not really designed for humans past early childhood, say 5 or 6 years old.
And the calcium in it.
A lot of the calcium in commercial milk is often added, fortified. And beyond that, the issue isn't just getting calcium, it's how your body manages it.
Right. You mentioned management before. So just loading up on calcium isn't necessarily the answer. What happens if the body doesn't handle it well?
That's the danger. If your body's systems for directing calcium aren't working properly, that excess calcium doesn't necessarily go to your bones.
Where does it go?
It can end up sticking to the lining of your arteries and blood vessels, the endothelium. This leads to calcifications, hardening of the arteries.
So too much poorly managed calcium is actually a risk factor for cardiovascular issues.
Potentially, yes. It underscores that you don't just need the raw material, you need the whole system working correctly to put it in the right place.
Okay, what about the other big trend, collagen supplements? Hydrolyzed collagen is everywhere. Is that the fix for joints?
It can certainly help, but it's not a magic bullet. Collagen, even hydrolyzed, is a pretty large, complex protein molecule.
Difficult to digest.
It can be, yeah. Especially if your digestive system isn't firing on all cylinders. Like any supplement, really, collagen works best as a complement when your foundational habits are solid. And a key part of that foundation, as we hinted earlier, is your stomach.
Right, let's dive into that. You said the stomach connection is maybe the most crucial insight here. Why is stomach health, specifically gastric acid, so fundamental to our skeleton?
Okay, think of your stomach acid, your gastric function, as the master regulator of your body's overall pH balance, your internal chemistry.
pH balance, like acidity and alkalinity.
Exactly. Our body needs to maintain its pH within a very, very tight range to function correctly. The stomach plays a huge role in managing that, buffering metabolic acids.
And how do many people, often without realizing the long-term consequences, interfere with that vital regulator?
Through the chronic, often unsupervised use of antacids, especially the strong ones, the proton pump inhibitors or PPIs.
Like the ones people take daily for heartburn, reflux, gastritis.
Precisely. These medications work by suppressing or neutralizing the stomach's production of hydrochloric acid, which provides relief, yes, but it effectively shuts down that critical pH regulating function of the stomach.
Okay, so the stomach's offline as a pH buffer. What happens next? How does that impact bone?
Well, the body still needs to balance its pH. Metabolic processes constantly produce acids. If the stomach can't do its job buffering them, the body has to find another source of alkaline minerals to neutralize the acid.
And where is the biggest reserve of alkaline minerals in the body?
It's your skeleton, your bones.
No.
Yes. To maintain the critical blood pH for immediate survival, the body will start to strategically dissolve bone tissue. It pulls minerals, calcium, magnesium out of your bones to buffer the acid in your system.
So it sacrifices long-term structure for short-term chemical balance.
That's exactly it.
Yeah.
It prioritizes immediate survival chemistry over skeletal integrity.
That is profound. So taking these common antacids regularly for, say, 6 months or more, or even long-term use of other drugs like corticosteroids or certain painkillers that also affect the gut.
It can directly force your body to break down its own bones. It contributes directly to the progression of osteopenia, osteoporosis, and even worsens the environment for arthritis.
Wow. It's an unavoidable biochemical consequence then. Inhibit the stomach, and the bones pay the price.
It really highlights the danger of just treating symptoms like reflux without getting to the root cause of why the stomach might be struggling in the first place.
Okay, so we need to fix the chemistry, get the joints moving, and provide the right building blocks. Let's talk action plan. Movement first. What kind is best?
We need exercise that does two main things. Generates impact and involves lifting weight.
Impact first.
Directly stimulating the bone cells, telling them to get stronger. And lifting weights, or resistance training, causes muscle contraction.
Why is muscle contraction so important here?
Because contracting muscles release hormones, myokines, that actively promote tissue regeneration, including bone. So don't fear activity, fear being sedentary.
And other lifestyle factors.
Yeah, don't forget hormetic stressors, things that challenge the body slightly to make it stronger. Sensible sun exposure for vitamin D is huge. Brief exposures to cold or heat can also stimulate beneficial systemic responses.
Right. Now, nutrition. If milk isn't the answer and collagen needs support, what's the star player for bone and joint regeneration according to the sources?
One food stands out consistently. Properly made bone broth, caldo de huesos.
You emphasize properly made. What does that involve?
It needs time.
Yeah.
You really need to simmer the bones for a long duration, ideally like 48 hours.
2 days.
Yeah, it sounds like a lot, but that's what it takes to really extract all the good stuff, the collagen gelatin, the minerals, the amino acids, all in a highly bioavailable form.
And what does it do?
It provides the direct building blocks for bone and cartilage, obviously. But, crucially, it also seems to support liver function.
The liver. How does
Yeah.
that connect?
A healthy liver is better at managing all sorts of metabolic processes, including those involved in bone turnover, the balance of breakdown and rebuilding. So, better liver function indirectly supports better bone health.
Interesting. What else for an anti-inflammatory diet?
Think fatty fish, like salmon or sardines for omega-3s, and load up on anti-inflammatory spices. Turmeric, black pepper, which helps turmeric absorption, garlic, ginger. These help calm that inflammation around the joints we talked about.
Okay, finally, supplements. Assuming movement is happening, the stomach is working better, what targeted supplements can accelerate things?
We kind of need to think in two categories. For targeting arthrosis, the joint surface,
Right.
you'd look at things like collagen, glucosamine, chondroitin sulfate, maybe even specific peptides designed to support cartilage and osteoblasts, the bone-building cells.
And for osteoporosis, the bone density issue.
The absolute non-negotiable pairing there is vitamin D3 and vitamin K2.
D3 helps you absorb calcium.
Correct.
And K2, what's its role again?
K2 is like the traffic cop for calcium. It makes sure the calcium you absorb actually gets directed into your bones and teeth, and crucially, away from soft tissues like your arteries.
Ah, preventing that calcification problem we discussed.
Exactly. But, and this is really important, there's a major warning with K2.
Okay.
Vitamin K2 can interact with blood clotting. So if you are taking any kind of anticoagulant medication, any blood thinners,
Warfarin or others.
yes,
Yeah.
you absolutely must talk to your doctor before starting vitamin K2. It's contraindicated for many people on those medications.
Critical safety point. And one last tip for taking these supplements, especially the fat-soluble ones.
Yeah, D3 and K2 are fat-soluble. Often the peptides benefit too. Take them with a source of healthy fat, a little olive oil, some avocado, coconut oil, maybe ghee. It dramatically improves absorption.
Okay, so much to rethink here. This deep dive really changes the perspective on skeletal health.
It does.
It's not just about bones in isolation. It's holistic. It hinges on movement, not rest. On fixing gut and stomach issues, not just masking symptoms with antacids. And then using targeted nutrition and supplements intelligently.
Absolutely. And maybe the single most profound takeaway for everyone listening today is this. Your body prioritizes its core chemistry over its structure.
Meaning it will break down bone to balance pH if it has to.
Exactly. So never, ever underestimate how directly your stomach function impacts the very integrity of your skeleton's a deep connection.
Which really makes you wonder, given how interconnected everything is, what other chronic health problems might actually stem from treating symptoms locally like reflux instead of looking at the underlying metabolic picture?
That's a great question.
Definitely something for all of you to keep exploring. Thanks for joining us on the deep dive. We'll see you next time.